Welcome all to this webinar on the WHO guideline development process and the new wasting guidelines that are going to be developed. We'll just let everybody join in and take a few minutes as you all come in, and just encourage you to introduce yourselves on the chat box, so we get to know which of us and where we are around the world collecting together today. So welcome. So welcome all of you joining. I see you're all still popping in. So we'll start in a minute or two. We'll just let everybody register, and please introduce yourselves in the chat box as to who you are and where you're coming from, so we can all see who's coming and who's gathering together today. Great to see you all coming in from all over the place. Just seeing we've got Nepal, we've got the Philippines, we've got the US, UK, Canada, and multiple organizations as well. We've got India, we've got Zimbabwe. Great turnout. We'll just give it a couple more minutes, as I know sometimes there's a bit of a time lag. Everybody's using Zoom these days, so sometimes there's a bit of time lag as well for people being able to join. Okay, so we will get started, and my name is Marie McGrath, one of the technical directors at the Emergency Nutrition Network, or ENN, based in the UK, and delighted to have you all on this webinar today. I'd like to welcome in particular Pura Racyo-Solon and Zita Weise Prinzo from WHO, who have managed to make some time in the very busy COVID schedules to share information about the process of the guideline development and then the wasting guideline development itself that is in the planning. And so before we kick off, I've just got a few sort of practical things for you just to outline. The session is in English only. As you see, everyone will be, all the participants are muted and videos off, as we've got such a big group of you joining, but we do have a chat box facility, so please pose any questions that you have through the sessions in there, and we have 2 Q&A sessions. So Tash, one of my colleagues at ENN, will be monitoring the chat box, and we'll select out questions to address to the team at WHO in the relevant sessions. Any questions that we run out of time to address, we'll collate and share them with the WHO team, and we'll then collate that feedback and share it all with you as we follow up on this. The session is being recorded, and it'll be available shortly afterwards on ENN's Global Media Hub on our website, and you can follow the links from our ENN webpage, www.ennonline.net. We asked you when you registered if you had any questions that you would like answered. So we've had a look at those. We've fed them back to the team at WHO, and they have reflected many of these in the presentation that they have prepared, and also we'll use a couple of them as some opening questions for them to kickstart the Q&A. But as I say, we'll monitor the chat box, and we'll be selecting live questions from you too. So without further ado, I'd like to introduce Pura, who is going to kick off with us, and she is going to outline the guideline development process. And she's a scientist at the Department of Maternal, Newborn, Child and Adolescent Health and Ageing at WHO. And she's a seasoned individual when it comes to these guidelines. So thank you, Pura, very much for joining us, and I'll hand over to you now.
Thank you, Marie. And I'm about to share my slides and launch them. Okay, one more. Yep, does it work? Yep, great. Thank you. Hello, everyone. And thank you, ENN, for inviting me and Zita to this meeting to share with you the WHO guideline development process. As one of WHO's core function is setting norms and standards and promoting and monitoring their implementation. Guideline development is, of course, very important to us and one of WHO's quintessential functions. We have a book called the WHO Handbook for Guideline Development. This was published in 2014. The book actually has 13 chapters, but online there are 5 more. So our handbook has 18 chapters in all. It defines the procedures and standards for WHO guidelines, and which should be evidence-informed, transparent. There should be a guidelines review committee secretariat that looks over the quality of all our guidelines. There's a peer review feedback for everything that we put out as norms and standards. So what is a WHO guideline? It is any document that has WHO recommendations, and recommendations are provides information about what policymakers, healthcare providers, or patients should do. We have 4 kinds of guidelines. We have the standard guideline, usually takes about 2 years to develop. It has a full systematic review, a full guideline development process. We also have compiled or consolidated guidelines. Usually it consolidates existing guidelines review committee approved recommendations. We have also, and very recently, a lot of these rapid advice guidelines, which are compressed and abbreviated process in response to public health emergency, like what we're in now, and interim guidelines, which are either standard or rapid advice guidelines, but are then have a narrow scope and an anticipated short shelf life. We are also moving towards, of course, improving our processes always. And so we are also developing processes and standards for living guidelines, where, of course, we optimize the guideline development process, allowing for individual recommendations to be updated as soon as new relevant evidence is available. What is then not a guideline? Several things. Documents that state the established principles, like human rights documents, WHA, World Health Assembly resolutions, standard operating procedures for pharmaceuticals or vaccines or technologies, also how-to documents and manuals or implementation guides. So the WHO guideline development process is something like this. And we'll go through each step one by one. First, there is a request. There's usually a need of a member state or several member states that comes through to us through our country offices, our regional offices, and often through the World Health Assembly. So once a need is seen, and a WHO technical unit starts the planning process, which means that we confirm whether we have enough resources and time. We draft the scope and the target audience for this guideline. We determine what exactly the questions that are being asked, where we need guidance from WHO. We also ask the question whether this is something that actually WHO guideline is needed for. because sometimes it's not a WHO a question. And then, so we put together a WHO steering group. This is individuals from different relevant departments within WHO. As a group, the steering group then identifies potential guideline development group and external review group members. That's GDG and ERG. They are key members to this guideline process. We obtain disclosures of interest and we manage those interests. We submit a planning proposal to the guidelines review committee. So once we have the GDG, we convene them. And the first task of the GDG, the Guideline Development Group, is to set the scope of the guideline. And that is to identify the key questions that will be answered. And this will guide the systematic review of the evidence. The Guideline Development Group also prioritizes the outcomes into critical versus important outcomes. So once
sorry,
yep.
Pura, just to interrupt. Sorry, would you be able to put your screen on full mode, your slides on, because we can just see your notes.
Oh, right. So I see. Wait, let me try to.
It just says quite small.
Yep. Yeah. Okay. Let me stop share, and then try that again. This is the slide. Share and start. This, can you see the full thing or just the notes?
It's still the notes again.
Okay. I think it must be maybe this. Did that work?
No, that's zoomed in. That's too big.
Okay.
If it doesn't work, doesn't matter. That's fine. Don't worry. But it was just in case it was a simple solution.
Oh, okay. Okay. So continue.
Can you just revert back to what you were doing, because we cannot see this one now.
Oh, right. I see. Okay. Let me try that again.
Sorry.
This one is escape. So, okay. Again, share this slide and launch. Is that sort of better?
Yes.
Okay, let's see.
Yeah.
Okay,
so yeah, so that's back. Okay. Don't worry, that's fine.
Oh,
thank you, Pura. Sorry to interrupt.
You can see the notes? Is that what this is?
Yeah, if you make it, that's better. That's better.
Oh, okay. Sorry, it usually goes to show the full screen. Okay.
No problem. Thank you.
We'll do this. Okay. So once we have the PICO question, we then commission or do the systematic reviews. This is by the systematic review team. And they, of course, perform a systematic and comprehensive evidence retrieval. So this includes the question of not just of the efficacy and safety, but also a qualitative synthesis of accessibility, feasibility, sometimes an economic analysis as well. So both a quantitative and a qualitative review. And the systematic review team also assesses the certainty of the body of evidence for each of the critical outcomes that were prioritized by the GDG. So once that's done, and a systematic review on average takes about 9 months. That's probably on the short, quick side. The guideline development group is reconvened. And to now formulate the recommendations based on the evidence and other explicit considerations. So once the GDG has formulated the evidence, the steering group then drafts the guideline document. It will send that out to the ERG, the external review group, for peer review. We finalize the guideline and submit again now to the guidelines review committee. Once it's approved, it gets published, disseminated, adapted, implemented, and evaluated, and eventually updated. So the required elements for a WHO guideline is that there should be a well-defined scope with a target audience. There should be broad representative and a representative guideline development group. This is mandatory for all WHO guidelines. That the GDG should represent all of the regions of WHO. There should be clear management of interest. There should be a priori key questions and systematic and comprehensive evidence retrieval, assessment of the certainty of evidence, and the formulation of the recommendation based on the evidence and other explicit considerations. So the contributors to a WHO guideline include the WHO steering group to oversee the process, the GDG and ERG, the guideline development group that formulates the recommendation, very key group, the ERG, external review group, which will also peer review the draft guideline. So all of these, the GDG and ERG, they are invited to be part of the GDG and ERG as individuals. And they declare their interests as individuals. They do not represent their institutions or organizations. We also do due diligence on all of our GDG and ERG. That means we scour the internet for any public statements that they may have had or anything, statements that could perceivably be a conflict of interest. And then we post their biographies, their brief biographies online for at least 14 days. So other people involved include the systematic review team, the methodologist, which could be internal to WHO or someone external that helps the process, and observers. Observers now are people who do represent their institutions or organizations, and they are there. They do not participate in the process, but they observe. And so all of these contributors need declarations of interest. So part of the process, while we are in the process of developing those guidelines, all the materials are confidential. So all of the contributors sign a confidentiality undertaking. Evidence retrieval, assessment, and synthesis, and the formulation of recommendations. We use WHO uses the GRADE approach, which is designed to reach agreement on a common, sensible approach to grading the quality of evidence and the strength of the recommendation. So what that is that there are two parallel processes of guideline development and systematic review. So once we have the PICO question, a question in population, intervention, comparator, and outcome format, a systematic review is done to answer that question. The systematic review team creates the evidence profiles, and the certainty of evidence is rated for each outcome. And then, so this is all of these are presented to the guideline development group during the second meeting. And the GDG decides whether, one, there is enough evidence to actually make a recommendation. They decide, secondly, whether that recommendation would be for or against the intervention. And three, they decide whether that recommendation is strong or conditional, based, one, on the evidence, but also other explicit considerations. For example, values and preferences, resource considerations, equity, human rights, acceptability, feasibility. So what makes the GRADE approach special? It's a sequential assessment of the certainty of the evidence, and then the judgment about the balance between benefits and harms, and then a decision about the strength of the recommendation. So there is a separation between the certainty of the evidence and the strength of the recommendation. So these are, I've been mentioning the considerations, the explicit considerations in making recommendations. Evidence is very important, but it's insufficient to make a recommendation. And these are some of the the considerations that WHO guideline development groups look at. So these are from the first two columns. These are from the DECIDE framework, the evidence to decision framework. And from the last column is the WHO integrate framework. More recently, this is a closer look at the WHO integrate framework, and the considerations span individual level, population level, and system level considerations in developing guidelines, formulating guidelines. So the recommendations are brought about by the guideline development group. In a group decision-making process, the ideal would be to come to a consensus about the recommendations. And what we mean by that is that there is general agreement on the recommendation. If there are minor disagreements, we take note of that. We reflect that in the guideline. We can also vote as a tool to achieve consensus. Of course, the voting rules need to be set at the start of the meeting. I mentioned here 2/3. Often, actually, we have a higher voting rules than that, particularly for issues that are controversial, say, so we can go up as high as 70%, 80% for a voting rule to be carried. So once the guideline development group agrees that they would like to make a recommendation, that there's enough evidence to make a recommendation, and they decide whether the recommendation is for and against, they then need to say whether the recommendations are strong or conditional. And this is what those terms mean. A strong recommendation means that for a patient, most individuals would want that recommended course of action and only a small proportion would not. Whereas a conditional recommendation means most individuals in this situation would want the suggested course of action, but many would not. There's also different interpretations for policymakers. For example, a strong recommendation means that the recommendation can be adopted as policy in most situations, whereas a conditional recommendation would mean they will require substantial debate and involvement of various stakeholders before they can adapt this recommendation. So the recommendation is written usually as a statement that answers the PICO question, followed by the strength of the recommendation, whether it's strong or conditional, and then the certainty of the evidence. And then in the guideline document, there are justification remarks or rationale. Also presented in the guideline document is the evidence profile, the evidence decision framework, implementation considerations, and research priorities or gaps. So in summary, WHO guidelines meet the highest quality standards for evidence-based guidelines. They focus on member states and end user needs. They address the right questions, optimize usability, and have diverse stakeholder input. They are based on high quality systematic reviews on all relevant evidence. We use the GRADE approach to assess the quality of the evidence as well as translate evidence to recommendations. We incorporate all judgments in decision making are transparent and explicit. And thank you very much.
Thank you, Pura. Spot on time, indeed, gaining us minutes, which is always a miracle in a presentation and webinar. And indeed, that gives us a bit more time for questions and answers and discussion, which is a definite bonus. So I'll just check in with Tash, my colleague, Tash, just to see if we've got any questions that we could kick off from those listening in.
Yes. We have some questions. So people submitted a few questions prior to when they registered. So one of the questions which was already touched upon in the presentation, but maybe Pura you could go into in a bit more detail, is about how the WHO factors different resource levels for different countries into their guideline developments and recommendations.
Yeah. So research considerations is one of the considerations when we do the guidelines, one of the explicit considerations. Often our guideline development groups have health economists and do an economic analysis of the interventions in question, particularly in guidelines where this is seen as an important factor for decision making by policymakers. So yeah, that's definitely taken into account. Of course, our guidelines are global guidelines, so then a lot of the economic factors are contextual. So that's part again of the adaptation of the guidelines, of the implementation that policymakers need to think through. That indeed, usually the costs are very contextual. It depends on many things, right? Like, for example, how strong is your health system? Is distribution and logistics well set, or is that something you have to build, and so forth? So many considerations, yeah.
Great.
Any more from you, Tash?
Yeah, there are many. So could you say a little bit more about if and how the WHO works with countries to adapt guidelines to local contexts?
So WHO has country offices and regional offices. So our country offices and regional offices work very closely with ministries of health. And this is how our guidelines get translated into policies. So there's a lot of support in terms not just of in policymaking, but as well in the implementation, in the monitoring of that implementation, in supporting the health system be able to achieve this the recommendations when they're relevant to the country.
Great. There's a live question that looks quite easy to address. So could you just explain the abbreviation ERG and GDG that you mentioned in your presentation?
Yeah, sorry about that. So GDG is the Guideline Development Group. They are the key group here in this guideline development process. Usually we have something like 16 to 22 people. They are from all of the 6 regions, so which means there should be global representative, there should be gender balance, and they should be multidisciplinary. We should usually we have people who are academics, people who do research. We also have very important policymakers, implementers, so people from NGOs, from ministries of health. We have health economists. Usually we have bioethicists, human rights experts, sometimes a gender expert also. So it should be a good mix to represent a lot of perspectives to get to the best recommendation. If, for example, a guideline topic is controversial, if there are many sides to an issue, we usually take from each of those sides. So the just composing the GDG takes a few iterations. And then, of course, everyone goes through an assessment of potential conflicts of interest. The ERG is the External Review Group. They can complement the expertise that are already in the guideline development group, but their main task is to read through the guideline and peer review it for readability, clarity, correctness, implementability, And they can also participate in different at different time points during the guideline development. For example, in crafting the scope for the guideline.
Thank you, Pura.
Lots of questions coming in. So about the sort of evidence that you're able to use when you're developing your guidelines, do you also take, beyond published peer-reviewed journal evidence, do you also take into account operational evidence?
Mm-hmm. So the basic idea is that we get the best evidence, and then that evidence is graded in terms of its quality, its certainty. So of course, there's a hierarchy of quality in terms of evidence, and yeah, we want all of it. We look at it, and then they are graded, and then they are taken. The evidence is taken with the certainty of that evidence. I mean, the evidence is presented with the quality of that evidence that's already been done using the grade system per outcome, per critical outcome that the GDG also has identified when they define the scope.
Marie, you just tell me when to stop, otherwise I'll just keep going.
Keep going, we've got time. And I think looking at the questions, there's quite a few around the wasting guideline coming in. So what we do is we'll retain those for after Zita's session, as she'll be talking specifically on that. And indeed, we can always kickstart her presentation a little earlier just to give more time if many of the questions are coming on that. So Tash, if there's maybe a couple more on the guideline process, we can keep going with those.
Yeah, maybe you mentioned in your presentation about countries sort of member states nominating topics for review. Maybe you could talk a bit more about how topics are prioritized. That was one of the questions.
Mm-hmm. Yeah, so there's many ways to prioritize, and to some extent, each department has a prioritization system, and you can do this very formally, right? There's ways to prioritize gaps in guidelines and how they are prioritized. There's many ways to do it. There's also usually stage groups that's a technical expert group that come together and advise WHO. There's also those things. WHA, the World Health Assembly, is also a very good place to propose topics for prioritization. That's when all of the member states come together, or the ministries of health come together every year and discuss with WHO. So yeah. But really the easiest way is through our country representatives, the WHO country representatives. They are in country, they work very closely with ministries of health. They have a good grasp of what the needs are and what ministries of health need in terms of further guidance.
Thank you, Pura. One question I have, actually, a few people have asked me, Pura, is do governments have to adopt a WHO recommendation, or is it advisory to governments? How does that work?
So WHO is a technical UN agency. So we're here, our core mandate is to advise governments on what to do, is to provide them the best strategically evidence-based recommendations in a very transparent and specific way. And we do that so that the countries can decide for themselves what recommendations they actually turn into policy and what they do not, what they would adapt and and slightly maybe change because of course their context will be different. So what we do are what we develop are global guidelines, and then yes, a lot of these things get adapted by the countries into policies. But no, we're also not a police. Our guidelines are not legal documents that have police powers over government.
Thank you, Pura. That's great. Tash, any final ones from you? Or are they all chomping at the bit for wasting questions now?
Yeah, lots of wasting questions. I can finish off with one about the. Could you say something about, is there a process for the WHO to respond to countries that have operational questions when they are translating these guidelines into their context?
Yes. So again, a lot of that is the function of our country offices, country and regional offices. Yes, definitely. So there is, of course, communication between the headquarters, the regional offices, and country offices. And sometimes questions that come up from countries are actually common between several countries, say in a region or even in different regions. And then we get together, we communicate about how best to support countries with whatever they need to implement those recommendations in their context.
Great. Thank you, Pura. That's been really super helpful. And I think what we'll do is we'll transition now. I'll hand over to Emily, and my colleague is going to take us through the next session.
Thank you, Marie. So my name is Emily Mates. I'm also a technical director at ENN and just helping to facilitate this second half of this webinar. So we're going to follow the same format as the first half. So Zita is coming up to give a presentation on specific to the wasting guidelines. And then after that, there'll be time for questions again, which our colleague Tash is going to facilitate again. So if you've got questions already, do pop them in the chat box, and then and during the presentation, and then we'll get to them in a while. So I'll hand over to Zita now. I think she introduced herself before, but she's a nutrition technical officer at WHO and has long experience at WHO, so she'll be able to run us through that process. Thank you, Zita. You're on mute, Zita. Sorry. We can't hear you.
Oh, okay. I'm sorry about that. The classic mistake that everyone makes.
Very well now. Thank you.
Thank you for the opportunity to be here and present. I just wanted to say that I'm going to turn my video off for the presentation, but I'll turn it back on again for the Q&A. And I will see whether I can manage to share my screen now. Is that okay?
Yes, that's working well. Thank you.
Okay, so yeah, so my presentation is really going to focus on where we are at with the development of the guideline on wasting. This slide was shown by Pura, so I'm not going to go through it, but I will be going through the process in terms of request, planning, development, approval, to show you where we are at with the wasting guideline itself. Now, the first step is the request. As most of you will know, in mid-2019, the principals of the UN agencies issued a joint statement calling for greater action to address the prevention and treatment of child wasting, and mentioning WHO's normative mandate in updating the guidance and filling any gaps in guidance. WHO also coordinated the development of the GAP, the Global Action Plan on Child Wasting, together with the UN agencies, namely FAO, UNHCR, UNICEF, and WFP. and highlighted the priority actions on the prevention and treatment of wasting. So the request really came from not only from the countries, but very much sort of from higher up. Now to the planning, which is the next step. Good news is that WHO did receive funding for this work, and thanks to all the donors who have seen that this is an important area. Additional human resources are being hired by WHO because it's an enormous task, a very complex guideline. There's an additional position for technical support and a methodologist that is currently being hired. Now to the establishment of the groups. As mentioned by Pura, there's the WHO Steering Committee. The core group is really between the nutrition group. NFS stands for Nutrition and Food Safety Department, and the MCA group, the Maternal, Child, Adolescent Health. It's a bit longer than that, but yeah. So it's the Child Health group and the Nutrition group. We're working very closely together on developing the guideline on wasting. We are now trying to involve other groups within WHO to join the steering committee. These include the non-communicable disease people, the health systems people, communicable diseases, and emergencies. So meetings planned with this larger group within WHO. The guideline development group, the GDG, there is a potential list that has been developed. This needs to be discussed with the steering committee. Once that list has been put together, we then will have to ask for the forms for the conflict of interests and the confidentiality disclosures. These still have to be obtained and managed accordingly. So this needs to be done as a next step once the list has been put together. Just for information, the GDG group that will be put together will be published online. The list will be published online together with the DOIs for any comments. And as mentioned earlier by Pura, the GDG group has to be diverse. It has to follow the WHO requirements for establishing such groups. And in terms of wasting, it clearly, there are individuals from the clinical research perspectives, but also from public health programming implementation perspectives as well. So we're really trying to get a balanced group there. Now to the scoping of the guideline, which is still under the planning section. WHO had organized technical consultation end of last year together with the UN partner agencies, specifically on prevention and treatment of wasting. And the aim, the objectives of that meeting was to develop the basis for an updated technical framing of wasting and to agree on key topics in the area of wasting. That was the basis of the development of the Global Action Plan on wasting, the GAP, but also this already discussing topics for WHO's guideline development work. This meeting report will be put online shortly. Here are some of the broader topics that will be discussed at the next Global Guideline Development Group meeting, GDG meeting. The first area is around identification, diagnosis, and recovery of children with wasting. We know that in order to identify children at highest risk of mortality and at risk of deterioration of nutritional status, there's a need to identify the factors, the reasons, in addition to anthropometry that can indicate high risk. And how can these be operationalized in different contexts? So how can recovery be sustained and ensured? The next area is around treatment of children with wasting. So it's who are moderately wasted and who are severely wasted. We know that the medical and nutritional care of interventions would get a better understanding on what these are based on the risk of the wasted child, and when do we need inpatient treatment, and what medical care is needed. For example, what care for moderately wasted children with medical complications. Currently, these children are treated in pediatric wards as normal sick children, but do they need special care? So this is clearly a gap when it comes to the clinical management of moderately wasted children. And a better understanding around which children can be treated as outpatients, with what medical and nutritional care, and around the whole topic of supplementary foods, in what context are they needed, in addition to nutrition counseling, and what follow-up is required, and how how often, and so on. So there are lots of questions around the management of moderately wasted children. Then the area of management of infants less than 6 months of age. The identification of risk. We talk about growth faltering in this group now. And can MUAC be used as an indicator for screening? Does it identify risk appropriately in these groups? What about the treatment of medical complications? When are therapeutic foods necessary for stabilization, such as the F75 in these groups, and so on? So lots of questions around the infants. Then around prevention, or we were also talking about not only preventing, but also reducing wasting. They are the population-based approaches, but also the individual child-centered targeted approaches. And what should these be? We are trying to update existing guidelines. So it's updating elements of the 2013 guidelines on severe wasting, but also filling gaps in guidance, as I just mentioned earlier about there are quite a few gaps in the area of managing moderately wasted children and infants less than 6 months of age. These guidelines will include the individual clinical management, but also include population-based recommendations. And there are quite a few questions around the how-to, sort of the operational modality for delivery of care. For example, involvement of community health volunteers, how can they be used in the management of children who are wasted. Now to the background papers. There were background papers of scoping reviews that were commissioned recently. The deadline for submission for expression of interest to be an author for these reviews is 27th of September. For the 4 areas listed there, so it's around prevention, it's around moderate and severe wasting, and growth failure in infants. The aim and the purpose of these scoping reviews is to identify existing evidence, to summarize potential areas of uncertainty and controversy, and propose key questions that the guideline on prevention and treatment of wasting in children would need to address. So this work will be extremely important for the scoping meeting, which will be the first guideline development group meeting, now planned in November. We had to extend the deadline to give more time for these scoping reviews, which are very important. And the first meeting in November will really be about developing these PICO questions and trying to come up with a priority list of questions that will be part of the overall comprehensive guideline. And the finalization of the the list, this will be a decision of the GDG and the steering group. It is important, as I mentioned earlier, to frame the questions in such a way that they capture the issues at the individual and the population levels, as well as the risk stratified approaches for prevention and treatment, but also for follow-up and monitoring, that will lead to better child outcomes, and not to forget the effective use of resources as well. So that was the planning phase. The next phase is the development phase. This is once we have the questions identified and agreed upon, the priority questions, in the PICO format. These, that we will then submit a call for authors for the systematic reviews to look at the evidence around these PICOs. We're planning to publish this call by December this year. We then have to give the selected authors who will be conducting the systematic reviews time to do their work. So estimating a 5-6 month period. And currently we say by August 2021, we hope to have the systematic reviews, the completed systematic reviews. That will then be the basis for the guideline development meeting, or possibly there will be more than one meeting, since we will have quite a long list of priority questions that we'll have to go through based on the 4 main topics. This we aim to do in October, November next year. Once the GDG group, together with the steering committee, have identified and have agreed on the recommendations, this will all be reflected in the guideline document. What we're aiming is to have one comprehensive wasting guideline document with all the recommendations in that one document, rather than each recommendation in a separate document. And the aim is to have that drafted, at least draft version, ready by December next year. This guideline will then need a peer review, which will go into the January 2022, and we hope to submit the guideline to our guideline review committee for clearance by February 2022. So this is just really, these timelines are an estimate, and if everything goes as planned. The guideline document with the recommendations is not the end. It's actually just the beginning of the next process, which is developing derivatives, as we call it, or tools on the clinical care and wasting, and on wasting programming. We will be working on developing operational guidance documents, for example, updating the manual on wasting, and updating training packages that we have on severe wasting, developing policy briefs, but also updating the current policy briefs that we have. And of course, very important, because that's the whole purpose of us developing guidelines, is working closely with governments on the uptake of these recommendations, updating national policies and protocols, as well as integrating the recommendations and the interventions into national platforms. So it becomes an integral part of national systems. And this bit of work, our key stakeholders, our UN partners, our NGOs, it's extremely important to work very closely together. So very often the derivatives are joint products with our partner agencies. This is my last slide. It just shows the timeline of the different steps. The long blue line you see there, which takes the longest time, is really the completion of the systematic reviews. but this keeps changing a little bit. But this is just an example of the components, of the steps that it takes for developing a guideline, and the timeline. Yes, I think that was it. Thank you. Over.
Thank you very much, Zita. Thank you. If you could maybe stop sharing your screen for now, that would be great. Very interesting. Thank you. Very well explained. So now we have quite a while. We still have about 25 minutes to be able to try and answer some of the questions. We're going to do the same as before. Tash is going to ask a couple of the questions, and then we'll see what's going on that came in beforehand, sorry, and then we're going to see what's come up in the chat box meanwhile. Most of them will be referring to the wasting guideline, which Zita will answer, but if there are more general questions about the guideline development process, Pura will answer them. And Pura, if possible, when you answer questions, there have been a few requests that if you could maybe hold your microphone close to your mouth. I think you've got a nice...
Sorry about that. I didn't see the chat.
Softly spoken, so people are struggling to hear. Great. So Tash.
Yes, I will start with a few that were submitted in advance, and then I've copied down a lot that were asked after Pura's presentation as well. So maybe both Zita and Pura could address this and talk a little bit about how COVID-19 is going to impact the process and content of the guidelines.
Okay, I'll have a go. Okay. So during a pandemic or a public health emergency of international concern, we have the rapid guidelines, rapid advice guidelines. That means it takes a lot faster. It takes about 1 to 3 months to develop a guideline. It also means that we use rapid reviews rather than the full systematic review. So in other words, the process is expedited, and that's why we have all of the guidelines, for example, around COVID during this time. And they're developed as rapid and rapid advice guidelines, and they are also updated as soon as new evidence is available.
So maybe I just can add that's depending on what the questions are. I mean, if the questions are really around wasting and COVID, are wasted children at high risk of getting COVID, or COVID, how do you treat children who have COVID and are wasted? These questions are not going to be covered in this guideline process. As Pura said, that's a different process to the emergency group. So that's a separate process. Those questions are not covered.
Okay, great. So there's been a couple of questions from specific countries and more generally about the length of time it takes for countries to adopt guidelines, and then the WHO is coming out with another guideline when some countries are only just adopting the previous one. Is there any, do you have any comments on that process, or how we can facilitate uptake a little bit more quickly in countries?
Do you want to do the general bit, Pura, and then I'll go into the specifics of wasting?
Okay, so yeah, we don't have a standard way of addressing this. But more and more, we're coming out with comprehensive guidelines. That means publications take into account a lot of different topics in one guideline. So it takes a lot longer to prepare and actually produce those guidelines. They can have something from, I don't know, 300, 100 recommendations in one document. So you can imagine it takes a lot of preparation, a lot of recommendation formulation to get a guideline like that. So for example, examples of that would be malaria guidelines. They come out with guidelines that span from diagnosis to treatment and so forth. Also HIV, particularly because HIV evidence is still very fast. They come out very fast. They have already stopped making guidelines except every 2 years. So in between, they have stopped making guidelines in between. So every other year, they often have new guidelines. And that's a pace that in general countries are able to cope with. Yeah.
Maybe just to add, the benefit of these wasting guidelines is that it's framed under the Global Action Plan on Wasting, which is a joint UN, joint UN effort, let's say. And it's really, we really are now, and the development of guidelines is under this GAP process. So we really are trying to support countries also through the action plans that are being developed to be sure that they have the latest evidence based on the guideline that is being developed now. But we do hope that, the guideline process will not complicate things if we come up with new recommendations every year, which is not possible anyway. I mean, it's more the other way around, isn't it, Pura, that it takes too long in coming up with recommendations.
Okay, and then could you say a bit more about who and what the process will be for selecting members of the GDG for the wasting guideline?
The GDG?
Yeah.
As was mentioned, we are following the WHO handbook in the regulations that are there. It has to be a diverse group in terms of gender. All the WHO regional regions have to be reflected. And as I mentioned earlier, it's really about not only having clinicians, but also having the researchers, the academics, and very much not to forget the program managers and the implementers. The final list will depend on the conflict of interests as well. We'll have to manage them. So it's difficult to say now who they are because that is not yet final. But it's really trying to get the right balance. And the decision will be made by the steering committee of WHO. And there is a planning clearance process, which I actually didn't mention, but Pura mentioned that, which we also have to do and submit the planning clearance document together with the GDG group to the Guideline Development Committee.
Can I just ask in follow-up to that, Zita, are there names already ready for their GDG or nominations, or where are you at with that? Is that maybe a bit further down the line, or are you already thinking about that?
We have a tentative list that we need to discuss with the steering committee.
Thank you.
And another question. So there's been some talk about living guidelines as kind of a way forward. Do you think that the wasting guideline might be one of those? And could you explain what a living guideline is?
It's something that we're looking into, but when it comes really to the WHO process around living guidelines, I'll hand over to Pura.
So WHO has been looking into living guidelines. This isn't a new thing. For the past 2 years, we've been gathering information within WHO. Some guidelines already are living guidelines based on living systematic reviews. So some departments are able to do it, and they do it quite well. So we're learning from that, and we're now putting together a set of standards for what living guideline will be. So the idea is that it's optimized in terms of the speed of the update and the efficiency with which it will eventually have impact in the country. So yeah, rather than countries are also, this is also a balance in terms of exactly that question. We've just had a guideline. We've just put those recommendations in the policy. Now you're coming up with new guidelines. And some of that is based on a prioritization, right? On also the balance of what is the new evidence and how much that evidence will now change the recommendation. It's not so critical when the evidence continues to come in and they support the current recommendation, that the usually doesn't get prioritized for an update because it will just confirm what's already there. But once the evidence changes, for instance now with COVID and the pandemic and evidence keeps coming in, then it's really important to make sure that WHO is on top of that and updates those guidelines quite quickly, especially if the recommendations change. So there's that, and that's a process that WHO has studied and want to move forward with. So we have a few work streams working on making our guidelines living guidelines.
Great. A quick question for Zita. Could you clarify that edematous children are still included in this? Because there's a lot of talk about wasting.
Yes, they will be included because they are part of the definition in terms of children who are at risk of mortality and deterioration. Yes, they will be included in the questions.
Great. And do you envisage that there'll be a different or a specific section for emergency context versus development context? Was another question that we've had.
That will be discussed at the scoping meeting, but the different contexts is part of the discussions that will take place when it comes to developing the PICO questions. But what we've also done in the past is develop specific implementation guidance documents on emergencies for the emergency context. The specific example is the HIV and infant feeding. The recommendation was taken and an implementation guide was developed on how to implement that recommendation in the context of emergencies. So it's something we will be discussing as well, for sure, the different contexts, including emergencies, and also how to define emergencies, sort of acute, protracted, and so on. So it's something that will be covered, yes.
And we have a question. Could you comment on the separation of severe versus moderate and whether the guideline is going to be approaching those separately, or whether there might be some kind of combined management of both, as is kind of being discussed in the research and programmatic sectors at the moment?
Well, we don't know what the outcome of the reviews will be and what the recommendations will be. But if that's what the evidence shows, that's what we're going to end up recommending. The current recommendations still separate the severe and the moderate, and that's how we are approaching it. But we are, of course, looking at the risk stratification, which goes through the severe and the moderate. So it is trying to break the silos and look at other ways of identifying risk in children other than anthropometry. So clearly there might be new ways of looking at this that come up.
Okay. And a more general question perhaps for Pura as well as Zita, about reconciliation of previous guidelines when you get a new one. Does it completely replace everything that was in a previous guideline, or is there still elements of a previous guideline that might be relevant?
Well, maybe I'll just come up with a specific one, the other way around. The 2013 guideline reflects both. So it reflects the new recommendations, but also states the ones that are still relevant from the previous documents. So it doesn't mean that all the updates are only based on what one looks at and what one reviews. So there are some recommendations, let's say in wasting, that will be new or updated, and some older recommendations might still be relevant if they have not been reviewed or updated. I'm not being very clear, I know, but especially in the area of the management of severe wasting in a hospital setting. For example, the 10 steps, there are many questions there, and we're just looking at some of them. So the ones that we're looking at might have updated recommendations, but it doesn't mean that the other ones are no longer relevant. They continue till evidence shows that they need to be changed. I know. This is just...
Do you have something to add, Pura?
No, I think that, yeah, that answers that quite well. Depends. Depends.
Sure. So still quite a few sort of questions on the specifics of what will be in the new guideline, which of course, Zita, you don't know until you've gone through the process. But perhaps you can just tell us if you're planning to consider it. So anything about MUAC cutoffs, will that be changing, especially for infants less than 6 months, or just in general?
Yeah, we are including looking at trying to identify children at risk of deterioration and of mortality. So these, when we look at that, depending on how the PICO questions formulated, it's clearly also looking at not only the indicators, but also looking at cutoffs and how they would reflect better the risk of the child. And then a new question, which we haven't really looked at in the past, is around in infants, using MUAC in infants to identify risk. It's something that we will be including, but doesn't currently exist.
Great. What else?
The question sort of following up to that, can I just jump in with that? So in terms of new evidence that's coming, because you mentioned the at-risk evidence, is this sort of being tracked or noted by WHO so that you know when you need to update? And is there any sort of criteria where you say, okay, there's enough new evidence that's come out, and now we need to look at an update, or do you just sort of know, as it were?
I think this is linked. The way I interpret your question, or the question, is it's very much about living guidelines and trying to update recommendations when new evidence is available. And as Pura explained, one would consider an update if the evidence shows a different direction of of what the recommendation is currently saying, and if there's enough evidence to pull together the group again to have a look and review the current evidence. The current recommendation based on the new evidence. So this is this more flexible way of updating recommendations, which we hope we can incorporate in the wasting guidelines as well, so we don't get stuck with a guideline document for a long period of time till we update that document, so that it's a sort of an ongoing process.
Thank you. Ash?
Yeah, and there's a couple of questions on IETF formulations, or whether these guidelines will be relevant for LNS suppliers and makers. Could you comment on whether that's going to be in this guideline or that's separate?
There was a separate guideline process that was initiated and completed on RETF, but that was specifically on dairy or non-dairy RETF. And that guideline is at the end of the process, but we are developing the guideline document now, and it has to be cleared by the committee. So that's a separate process. Regarding LNS, depending on what the scope of the current wasting guideline that we're talking about is going to be, it's possible that the LNS question will be included. And that again depends on the evidence and what the outcome will be on LNSs and the purpose and the target group and so on. So,
another question: could you sort of specify a little bit more the process between the scoping review and the systematic review, how you translate the scoping review information into PICO questions, because that seems like quite a tricky process.
Okay, so I'll take that on. That's the scoping review looks at what evidence there is, right, and what outcomes are being assessed in studies. So it's sometimes in the guideline process, scoping review is helpful going into the first GDG meeting, the meeting where the guideline development group will set the scope and prioritize the outcomes for this guideline. So then the guideline development group then has a very clear idea of where the evidence is and where the evidence isn't, because that's what scoping review does, right? It's a systematic search for the evidence without actually going into the assessment of the evidence and so on, like a full systematic review. But the scoping review can give you a good idea of whether there is evidence on, say, specific topics or specific interventions, and whether they have evidence around specific outcomes, say. So that's really useful for the GDG, because sometimes it helps them to then prioritize what questions to ask. Because of course, a guideline development process is quite intensive. So that first meeting is actually quite important to set how the rest of the guideline will look like, and what evidence will be looked at, and what outcomes will be looked for. Yeah, but it's sorry. So to answer the second part of the question, that is not the systematic review, the full systematic review. Once the PICO question is set, that means we know the population, the intervention, comparator, and outcomes that are critical and prioritized by the GDG, then that will then inform the systematic review that will be done and will be looked at on the second GDG meeting.
Great. And a question here about just the age range that these guidelines are relevant for. Is it just for children under 5 years, or might it be broader than that, Zita?
It's again something that will be discussed at the scoping meeting, but it will likely be for children from 0 to 5 years of age, but we need to discuss this with the further with the group.
Okay. I think we've covered most things.
There was just a quick question from Marie about, do you have information on where our colleagues who are listening in can go for updated information on the process and the timeline? Is there a web page, or are there going to be updates from WHO, or because it's quite a long process from now until, I think it was what, middle of 2022 or something when the process is done. So will there be updates, or will there be information posted?
Are you referring specifically to the wasting guideline?
Yes.
It's a good point, because as you've seen, the process is lengthy and complex. It's not something we've really thought about, but for the general public, of course, we have the UN working groups and the different groups that we continuously share information with and collaborate with. But for the broader audience, we wouldn't. It's a good point. We will need to look into that.
Thank you. And just we had an earlier question about COVID and the impact, but I wonder and whether you know, COVID will be considered. But I just wondered, do you it's hard to anticipate, but do you anticipate any sort of additional delays in the process because due to COVID, or do you think it's you're getting good at doing online and virtual discussions? So do you think that will work quite well?
It's extremely challenging doing everything online, not only the technology at times, but sitting around the table with the GDG and the observers. And I think one is missing a lot by doing this virtually. It's much more difficult to manage, especially with the chat as well. So, but this is the reality at the moment, and we will continue doing it this way. So we are not going to wait to have a face-to-face meeting. We'll just continue with the process.
Yeah, better to keep it going and try and manage it somehow than stall. Great. Okay, so we've just about reached the end of our time. We thank you very much to Zita and Pura for answering all those many questions. I'm going to hand back to Marie now to wrap up and close. So thank you also to Tash for asking all the questions, and here's Marie.
Mm-hmm. Thank you, Emily, and to Pura and Zita. And I think just resonating what you said, Zita, I think we're all zoomed out at the moment, and having sat in several face-to-face guideline meetings over the years at WHO, there's a great interaction, and by day 3 you've exhausted every discussion and avenue, and you get to a place where you can formulate recommendations. It's very hard to recreate that interaction, you know, in our virtual world, and so I think we have to keep going and maximize on this, and ENN certainly is very committed to help and support whatever we can, and including the dissemination on the process and where it's up to at different points. And thank you so much for doing this webinar, because I think this is a great start, and so many people asking questions shows a real keenness to engage, and the people around this forum are those who can really help in uptake and informing the process. So delighted with the turnout. I want to also thank the Eleanor Crook Foundation, the team there, who indeed this webinar was sparked by conversations with that gang, and they've actually supported ENN in delivering this webinar. So many thanks to them. As I said earlier, any questions that we haven't managed to get round to, or maybe on related subjects but not directly related to the topic of this webinar, we'll compile and share with the WHO team, and we can compile feedback and share with all of you in follow-up. And the recording, as I said, will be on our website, so please, you can share it with colleagues and refresh your memories again, if you so please. So, and just finally, just to say, as you leave, you'll be taken to a page where there's a very, very short evaluation. A couple of questions will take you a few breaths to complete. So if you could just take that time as you duck out to complete that will really help inform the next webinars that we do. So again, thanks again, and we look forward to the next one. Bye-bye.
Bye. Thank you.
Thank you. Thanks a lot.